Good morning, I'm Nur Farisha Elia and this is OBM310 News. Have you ever experienced heart racing, chest pain, or trembling? Or have you ever seen people around you experience it? You do? Maybe you or your people around you having a panic attack. But how do we explain panic attacks? Panic attack is a severe fear that is unexpected and immobilizing in its intensity. It frequently strikes without warning and there is no clear trigger. It then strikes when the person is relaxed or asleep. Panic attacks happen only once, but many people have them frequently, and there appears to be a link between a major life transition and extreme stress. It is a normal reaction to stressful or threatening situation, but do not worry, these panic attacks can be treated. Doctors from the Bagan Specialist Center who are with us this morning will tell us more about panic attacks.
In Malaysia, there are various diseases related to mental illness such as major depression disorder, anxiety disorder, eating disorder, and panic attack. I stand here to tell or give information about panic attack. In every disease that occurs, there are some symptoms that we can identify. So here, I will tell you some symptoms that can be identified when a panic attack occurs. For the first one is chest pain. A panic attack will usually last a few minutes but can come in a wave and feel more continuous. As people can experience severe chest pain during a panic attack, it's possible to feel soreness afterwards. Chest pain is a common symptom of anxiety and panic attack. Many people say it's the natural feature of their worst episodes. Besides that, it makes a person feel as though they are having a heart attack where they are worried that they are going to die. If you know, panic attacks involve a lot of the heart attacks and our respiratory systems. Next, difficult breathing. The heart attack increases to pump blood to the organ faster, which reduces the muscle functions. It also causes a person to breathe more quickly to provide more oxygen to the muscles. The result can be shortness of breath. Everyone feels anxious from time to time, but for some people, anxiety significantly gets in the way of daily life. Third, racing heart. Some people think they are having a heart attack because it feels like their heart is beating fast or irregularly, or even that they are going to die. In many cases, a panic attack triggers a fast heart rate, also known as tachycardia. The heart rate may speed up to 200 beats per minute or even faster. A fast heart rate can make you feel lightheaded and short of breath, or you might feel fluttering or pounding in the chest. Usually, tachycardia that happens in response to emotional stress and only lasts a few minutes is not harmful. If it happens regularly or you have possible symptoms of heart attacks, you should seek medical care. Last but not least, panic attack can cause of dry mouth. Every system in human body counts on water to function, and the brain is no exception. In fact, about 75% of brain tissue is water. Research has linked dehydration to depression, anxiety, and panic attacks because of mental health is driven primarily by your brain's activities. Long story short, dehydration causes brain functioning to slow down and not function properly. It is important to think of water as a nutrient your brain needs. So, drink a lot of water. I hope with some of the symptoms that I have explained a moment ago, we can both look seriously if there are these symptoms in ourselves or people around us. The brain, also nervous system, play key roles in how you perceive or handle fear and anxiety. There are 3 causes of having panic attacks, which is family history, such as genetic, or maybe there are family members who have mental illness such as anxiety, depression, or panic disorder too. Besides the serious illness of beloved one, especially family members that lead to the death, also one of causes to someone for having panic disorder easily. Second causes is mental health issues. People who have anxiety disorders, depression, or the other mental illness are more prone to have the panic attacks. In addition, a person who have a traumatic event such as a history of childhood physically or sexual abuse, also a serious incident in past way, are the reason for having panic disorder too. Last causes is substance abuse problems such as alcoholism, smoking, excessive caffeine intake, and drug addiction can increase the risk of panic attacks. Moreover, people who not smoking can also having panic attacks from cigarette smoke. Panic attacks can strike suddenly and without warning at first, but they are usually triggered by specific situations over time. According to some research, panic attacks are caused by our body's natural fight or fight to a dangerous situation. For example, a grizzly bear charged at you and your body would react instinctively. As our body prepares for a life-threatening situation, our heart rate and breathing rate would increase. In a panic attack, many of the same reactions occur. However, it is unknown why a panic attack occurs when there is no obvious danger.
The conversation you just saw is based on true situation that happened to my patient, Alicia. As you can see, Alicia did not know what to do during her panic attack. Therefore, today we are so lucky because I would like to share with Alicia and you ways to activate the parasympathetic nervous system and calm down your body during a panic attack. Firstly, if you are at home, you can lay down your body or take a seat as it helps to loosen up your muscles that are tense because it holds the stress for you. While laying down or sitting down, you can put your hand on the stomach and purposely push it in and out. In and out. Let us try to do it together. Put your hand on the stomach and push it in and out. In and out. It may seem as a simple routine, but it is quite beneficial because when we are anxious, we frequently breathe hard and take very short breaths using the upper parts of our chest. Moreover, the absence of oxygen will cause our hand and toes to go numb. But doctor, what if I'm outside where I have nowhere to lay down or sit? Let's say you are outside. All you gotta do is practice 4-7-8 breathing technique. How to do so? First, inhale through your nose for the count of 4. Second, hold your breath for 7 seconds. And third, exhale through your mouth for 8 seconds. And repeat it until your body relaxes. Although panic attack doesn't cause a long-term physical harm, but it can limit someone's daily life as the fear of having another attack is there, which cause more panic attacks. Therefore, we may take a few precautions to avoid it, such as practicing breathing method like the one I mentioned earlier. Furthermore, practicing regular exercise and eating regular meals
as it helps in releasing tension and stabilize the blood sugar level. By doing these steps, we can prevent ourselves from a diagnosis of panic disorder, which needs antidepressant medication and cognitive behavioral therapy or CBT as the treatment, which can carry a side effect. However, we need to believe that fear can hurt us, but holding on to it will escalate panic. Therefore, although we never have a panic attack, understanding and preventing it will help us to identify one in ourselves.
So, as we know, panic attacks is not a small matter among us and can lead to the unwanted accidents, or should we say, it can have increasingly destructive effects on person's life. Did you ever wonder what's the implication by panic attacks? Well, it affects social withdrawal, poor work performance, decreased quality of interpersonal relationship, and last but not least, can lead to severe illness. Now, let's dig deeper into the implications to people. Firstly, panic attacks lead to social withdrawal that be both a symptom and a cause of anxiety itself. It can also characterize an anxiety disorder that will make them have a strong desire to retreat from society, staying home, and isolating themselves from the world itself. Next, it affects work performance by affecting teammates, who in turn may begin to question their purpose as well, and then lead to lower morale, disagreements among team members, insubordination to the managers, and general lack of support for teammates. Then, panic attacks implication also make quality of interpersonal relationship decrease. That turns people to be more likely to have highly inhibitive interpersonal relationship problems, different from everyday social awkwardness, and it is common for people with personality struggle with building and maintaining their relationships. Last but not least, the worst one implication is that panic attacks can lead to severe illness. To be exact, when people may become frustrated as they struggle to find a way to calm themselves, or for severe anxiety attacks, they may need to seek emergency medical treatments in order to get over their attacks and get back to calmer mental state. Furthermore, individuals who do not cope well with stress are more likely to develop high blood pressure, diabetes, and heart disease that may lead to the unwanted accidents. So, if you don't have any one of those implications, then I would say you are safe and doing fine.
Thank you, doctors from Bagan Specialist Center, for informing us about panic attacks earlier. We have come to the end of OBM 310 news, but before we wrap up, what do you think about it? Is panic attacks serious? If panic attacks make you feel like you are having a heart attack or another serious condition, they won't kill you. Panic attacks, on the other hand, are serious and must be treated. It should be diagnosed as soon as possible so that effective treatment can begin. If you are experiencing any of the symptoms listed above regularly, you must contact your physician for further assistance. The doctor has mentioned before, the primary treatments for panic attacks are psychotherapy and meditation. One or both types of treatment may be recommended depending on the patient's preference, their history, and the severity of the panic. Meeting with the therapist for several months can help in the treatment of panic attacks. Following that, follow-up visits are planned to ensure that the panic attacks are under control. I'm Nur Farisha Elia, and thank you for tuning in. We'll see you again.